every year is really meant to stress you in some way, and not stress you mentally, but stress your clinical comforts and really push your bounds and make it so that you are forced to grow.
Every year of residency here at Cincinnati is kind of, your first year you start in your basic, you're just fresh out of medical school, you're kind of getting all your skills, you're trying to remember everything that you'd forgotten over the last year. And then second year is a pretty big jump up, and third year is an even bigger jump up in terms of your clinical skills, the number of patients you're seeing.
The fact that we jump right into clinical stuff right away was a really big benefit for me. Working with the fourth years and first year, they kind of supervise us in the pod, and they've been really great because they give us a lot of autonomy as physicians, but they're always there as sort of like a guiding hand, if you will, if we mess something up or if we don't have the answer to a certain question. So there's a lot of interaction between you and the senior residents, and that's really a great thing about first year here.
That's one of the things that I really liked about this program when I was looking at different programs, is the specific role in each of the years. And now that I'm actually here, it's something that I appreciate even more. In second year, having our first, being part of air care and also working with the procedures and the SRU, and having our first set of rooms to ourselves for the first time, which is also really great.
You still manage your own pod, which is an 8-bed pod, which is a big step up from that first year. It's just you, 2 nurses, and a tech, and then of course the attending's there to kind of help you out. But it's your pod, you run it, you kind of move the patients through and get a lot out of that, one-on-one experience with the attending as an R2. And then of course there's always air care, which is awesome.
In your third year residency, you work as covering the SRU, which is the shock resuscitation unit, which is 6 bays of trauma or medical. It's the sickest patients in the emergency department. But at the same time, you also have 9 or 10 regular pod beds, just like what you're used to working in as a second year resident or a first year resident. But this time you're covering all of those pod beds in addition to the SRU.
Really getting to be that third year who is running resuscitations of really any etiology is what is unique to this program, and is such a fantastic learning experience.
I think one of the special things about our program is the R4 year. It's not just another year where we see patients, which we do as well, but it's that we have the opportunity to sort of be junior attendings. We have an entire pod which we're responsible for. We supervise the interns and all the off-service residents. Could be up to 4 or 5 residents at a time.
Fourth year is kind of this huge lateral kind of turn in direction where you've gone from actually being directly involved in patient care to really kind of overseeing off-service residents, the interns here, the first years who are just getting started and going through the same process that you went through 3 years ago.